of you who may be new to this coalition call, it transformed from previously the Town of Gilbert nonprofit town halls that we implemented during the initial COVID crisis, and decided to formalize the group into the East Valley Resource Coalition. So we have regular meetings now, really to provide information and to collaborate on projects and needs and to support each other. So thank you so much for being here today. I, of course, want to recognize Sarah from the Town of Gilbert, the president of Gilbert Chamber, Melanie Dykstra, who is from the Town of Gilbert, as well as Amanda from One Small Step, who all helped lead and plan for this regular meeting. So thank you very much for your planning and for also being on the call today. I'd like to begin by ensuring that everyone is connected, that you can hear okay. To remember that you want to stay on mute unless you're actually speaking, to reduce any extra noise that could interfere with the speakers today and the program. That being said, we want to make sure that we can see you. So don't be hesitant to put your camera on. Use the chat feature as needed for questions, comments, and concerns. And as Sarah stated earlier, it's really helpful if you're able to rename yourself by going into the participant list, right click on your name and look for more, and you simply just add your organization next to your name. That way we can see that listing as well. It's very helpful. Today's agenda is a very full agenda today. We're going to have some fun. We're going to have a breakout session. It's going to be a 20-minute breakout session in which we go into about 5 different groups. And over a 20 minutes period of time, we're going to introduce ourselves, our organization, and briefly state what is the surprise impact that your organization is having at this particular time. And then to just discuss that a little bit. You're going to want to pick a scribe as well once you're in those groups, and I'll remind you of that later. And then we'll come back, we'll have a report out, so to speak, on what some of the key impacts were for your organizations. We're then going to move into organizational spotlights, in which we get the opportunity to hear from 5 of our organizations that include Ascend, Hope Women's Center, Amanda Hope Rainbow Angels, Child Crisis Arizona, and I think those are the 4 we have today. I think we're moving Jewish Family Children's Services, or do we have them on today as well? I believe.
They're on today as well.
They're here. They're here.
Okay, perfect. So we have them on as well today. So we're going to get a quick highlight on each of those organizations to help us have a better understanding of who they serve and their particular services. We're going to then move into an opportunity for Janine Fowler, one of my dear colleagues from Maricopa County Department of Public Health, to give us a COVID update at this point in time, which is really important as we see some of the numbers rising again. And then to talk a little bit about not only the current stats, where we're at with things, but information that will be benefit to the organizations as we move forward with making sure people have clear information, understand where to access the vaccine as well. And then we're going to have an update by Melanie on a survey we had back in April covering some of the key information topics that were requested, really just checking in to see after the fact if you received the information that you need, or if there's any additional information you need on the specific topics that were mentioned. And then, of course, additional Town of Gilbert updates. And then we'll do a raffle on which organizations are going to present at our next meeting, and then we'll close up. So that is our agenda today. Again, a very full agenda. And now we're going to, are we ready, Sarah, to move into the breakout? Perfect. So what's going to happen, you're going to get moved into a room. You're going to pick a scribe. You're going to spend 20 minutes talking about what is the key impact for your organization at this particular time. And don't forget also, you're going to name yourself and your organization as well. We're going to all come back together, and then we're going to do a quick recap of what you all discussed. All right, are we ready to move into our rooms?
And I will give you a 5-minute warning so that you have an idea of when we'll be concluding the conversation.
Perfect.
All right, there'll be an icon that comes up on your screen, and you'll want to click that to join your room.
Services. Okay.
Sorry.
The black van is outside my house. No, I'm just kidding. He said the impact was innovation and pairing with other groups. They had food bank, which offered food boxes for families during COVID, and they had door-to-door delivery of resources. Sean Thompson and myself were pretty much from the same organization. He said the biggest impact is on how we do our jobs, considering we've been virtual since March of last year. For him, he started reaching out to certain groups such as LinkedIn, really diving into that to make sure he can have contacts with available resources that can help serve our families or the people that we serve as well. And said the biggest impact also was with our case managers and how they're doing their job, because we've had to do a lot of things virtually. And I kind of echoed what he was saying as well. But I also shared with him as a parent, one of the biggest impacts was with my daughter having virtual school. It kind of impacted her social interaction skills because she just had me and dad had to work, so I couldn't always conversate with her. So it was really having, now that we've released some of the restrictions, being able to get her back out with her friends and be rebuilding those communication skills and those social interaction skills. So that was pretty much everything that we had.
Awesome. Thank you so much. That was terrific feedback. And now we're going to move to group 2.
I believe that's Amanda.
I was just thinking, was I too or not? Okay, so we had some actually mostly different things than what Vance was talking about, but we talked a little bit about dipping clients. So we talked about seeing fewer clients than we thought we would see at this point, at least for my organization. And we wondered about, stimulus and child credit and how that might be impacting. And Laura from Save the Family was updating us on the moratorium for evictions and that's ending next month, and the impacts of that, and then the resources that are available too. So that was interesting because she was indicating to us that there are a lot of different places to find emergency financial aid to help, even though the moratorium sounds like it's going to end for evictions. And Kaylin shared with us some interesting information about their parenting classes. One thing they needed to do obviously was their parenting classes had been in person. They needed to shift to virtual, just like most of us. And they actually had a really good showing moving to virtual. And one of the unanticipated or surprise impacts was that they were able to reach much further out than they ever had before, serving people obviously who normally wouldn't drive in to their location for a class. So that was really cool. But another surprise impact was when things started opening up, they were thinking, okay, people are probably tired of virtual and ready for the in-person again. And so they started launching their in-person classes, and were surprised to find that people weren't coming back for that. So that's interesting. The convenience maybe it might be part of it, of being virtual. So they're considering adding back in more virtual classes. And then HD South, Denise shared with us some fun facts that normally during the summer, they're very low in attendance, probably because everybody in Arizona gets out of Arizona. So maybe because of the reduced travel this summer, she's actually had really high numbers of foot traffic. And it's been really nice having people back in her building, especially after a year of very sparse attendance. And she mentioned also her rental facility is booked every weekend, and people are doing it up to the nines, with all kinds of great decorations and celebrating everything they can. So for her, the surprise impact lately has been just a lot more attendance at times where she's used to seeing fewer people. And let's see, Just Serve was in our group as well. And several of us mentioned, especially HD South mentioned that we're still struggling with our volunteer numbers and having enough regular volunteers in our programs to help support the programs. And Just Serve to talk about, thinking that first of all, numbers did go down, obviously, health concerns and things like that. And then the closures, there was a lot of closures from us, the agencies. So where we were closed to volunteers. So there was a lot of confusion about whether or not something would be available. But she really was feeling like now that kids are back in school, that will really open up more opportunities for volunteers to get back into the community and start helping out again. So I think that wraps it up. Well, we did share that there were some positive impacts that came out of COVID, that with, like Vance was talking about, that forced us to think in different ways we served. And by thinking out of the box and doing some things out of the box, there's a lot of things that we've all agreed, like we'll probably continue using in our programs. That's
Perfect.
it.
Thank you so much. That was great. Again, some unexpected things occurring. It's interesting, some areas were having less attendance and some were having more. So it could both a benefit and a challenge as we look at how to reopen. All right, next we have group number 3.
Michelle was our scribe for hers.
Okay, I couldn't remember what number we were. We had some really positive feedback. Probably most of it was positive. One thing that Catholic Charities mentioned is that when you have a program that you need to get the word out about, it's really hard to do that when outreach opportunities are no longer happening. So that was one thing that they had to work around, and now they're excited that things are back in person and that they can go to outreach events again. Boost a Foster Family. She said that it wasn't necessarily connected to COVID, but they figured out a way to do telehealth for the physical exam that's needed for kinship foster parents to get certified. So that was exciting. She said it was one of those like, hey, what if we did this? That would help the families. And it had more to do with location and proximity to where the doctor was located. And they went for the idea, and that's helped quite a lot. So that's exciting. Maricopa Department of Public Health said there was a huge push for people to get vaccinated. That's what they've been working on, is getting the pods set up for people to get vaccinated. And then now we're kind of at a halt. So they had to deal with getting the huge push of people. And now it's like, how do we get people to come in and get vaccinated now that we're at kind of a lull? Ascend said that they were overwhelmed by how many people they could serve in a year and by how many people were willing to help support their cause. And they were surprised by how well Zoom was received for fundraising and for some of the services that they provide.
Thank you so much. Again, some great information for everyone. Next, we have group 4.
That was us. I just kind of wanted to mention, so the names, just so you guys know who was in our group, because I think it was a real kind of unique and diverse group. So I'm Katie Haar. I'm from Chandler Gilbert Community College Service Learning and Civic Engagement Program. We had Shauna from Ascend. We had Ed from Arizona Early Intervention Program. We had Kayla from House of Refuge, Barb from ASK, which is Adoption Special Kids or Adopt Special Kids Program. We had Jen from the Town of Gilbert Community Resources Area, and we had Shelby from Amanda Hope Rainbow Angels. So lots of different folks that those organizations serve. But similar to what you were mentioning, kind of our biggest challenges were that transition period. We all went remote, lots of things went virtual. We tried to work around things that were virtual, and now we're kind of stepping back into this. Well, we could do stuff in person, but numbers are rising again. So what does that look like? Just that kind of transition. At work, we say dipping our toe in, right? We're starting to dip our toe in, but now cases are rising. So how do we support and facilitate both in-person and virtual opportunities? Ascend, of course, did mention that they have been open the whole time and they've seen areas that have really increased, but then there are other areas that have been a challenge. And a couple of the organizations mentioned this challenge that hasn't been brought up so far is hiring challenge. So there are some positions that have been opened and they've been challenges to get filled. So that's one area that hasn't been brought up by the folks that have already gone through, but just really just trying to figure it out, virtual and remote, and then trying to get positions filled and hired.
Yeah.
So that's probably our new information.
Yeah, that's great information. I appreciate that you brought up the hiring challenge because that's a challenge nationally. And a couple of things with the challenge is it's having a number of applicants to be able to consider for positions, and then are they qualified for the position? And it's across all over the place in regards to that. In some cases, they may be considered overqualified because they're trying to get some work post-COVID. In other cases, not quite hitting what they needed to be. And there's a lot of discussion around why there is the workforce challenge. Some people re-enter the workforce into different jobs in different careers. And so that creates a shortage for those areas that have lost the percentage of normal employees and applicants. So certainly in healthcare, we're increasing the number of travelers we have, for example. So that is very, very tough. I think it's going to be a challenge for a while. In some cases, there will be, the surplus is going to occur for some areas of growth, whereas historically areas that have done well are now challenged. So I think it's going to be interesting to see what happens going forward. Thank you for sharing that. And now we have group 5.
So that was our group. The luxury of going in group 5 is that most of the stuff we talked about has already been talked about, but I will just go through who was in our group. Kristen from Jewish Family, Ashley from Chandler Gilbert Community College, Kelly from Rebuilding Together, Valley of the Sun, April from DES, and Maria wearing double hat, ASU, as well as Positive Paths. So we spent a lot of time talking about getting back to the office and what that looks like, and we transitioned from there and spent probably the majority of our time talking about the challenges we were having with hiring qualified people. So to your point, Kathleen, and to group 4, nothing new, but pretty much everything we've already talked about staffing shortages and just trying to hire those people that are qualified for the positions that we need.
Great, thank you so much. This certainly has been lively, good conversation and may actually benefit us in what kind of discussions and topics we can have in our October session. I think highlights from all this. Do we have another group, Sarah, or are we good? We're good. Okay, certainly a lot of highlights include the hiring challenges and staff challenges. The challenge with transitioning from 100% virtual to in-person, and then recognizing, well, the numbers are going back up, so where do we really belong at this point in time? A lot of organizations are having that conversation. And then, of course, the increased partnerships and innovations that have occurred have been a benefit that we hope will continue going forward. So thank you for all that. Next on the agenda, we have our organizational spotlights. So we're going to start with Ascend. Each organization we have today will have 5 minutes to talk a bit about their services. We have Ascend, Hope Women's Center, Amanda Hope Rainbow Angels, Child Crisis Arizona, and Jewish Family Children Services. And we're going to start with Ascend.
Sarah, you're on mute, hun.
I was trying to get my PowerPoint to open up so I could share it with you. It opens up, but you guys can't see it, can you?
Not yet.
Let me see.
Dara, do you know how to share screen on Zoom?
Well, I did it once before down here where it says share.
Yep.
Yep.
It should show your document.
There you
Now,
go.
can you see it?
There we go. Ta-da!
Yay!
You did it.
So Ascend has been around for over 55 years, providing help and hope in the community for people in need. We serve people from everywhere. I think I would say it seems like we do have, a geographic area, but during the pandemic, I will say we had people come as far as Tullison to get a food box. And so we will always serve people in need the first time, even if they're out of our service area, and then we will get them to the service area that will best serve them. So I want to say that there have been lots of changes during the pandemic, and but I'm very excited to say that I feel like we were able to meet those challenges and step up to them. Last year we served over 16,000 people. And that's unique individuals. And I know since all of you come from the nonprofit background and stuff, you know what I'm saying. I don't usually say that to most people, but you understand what I'm saying. We started basically with our food bank over 55 years ago. 8 area churches came together and said, let's pool our resources. So a person can come and get food. I always say it's a misnomer that we give anybody a food box. So they can come and get food for 3 meals a day for 3 days per person in the household. They can come once a month and get that. That we take shopping carts out to people's car. If you think about a family of 5, 3 meals a day for 3 days per person in that household, that is far bigger than any food box that we could possibly give anybody. So then on top of that, they can come every single Friday and get what we call supplemental food. It's food that is, I would say, more perishable. And so they have an opportunity to come 5 times a month and get food. And what we see and what I always see in that is that's the difference between people being able to pay their rent, so they're able to stay in their homes. It's food in children's bellies so that they'll go to school, and then mom and dad can work because they don't need to stay home. So there's lots of things that happen around our food bank that I think is an amazing gift. Also, if you come into our food bank at any given time, we only have 2 employees in our food bank. You will see 30 people in there all the time. It is our volunteers that are our gift that make us able to do the work that we're able to do, especially in the food bank. Every day they're volunteers and they take ownership of their area and they teach other people when they come in. I'm amazed at all the work that happens in our food bank and how we're able to serve people. Now, let me see if I can get this to move. So we have 5 core programs. So we have the homeless and housing services. We have the food bank that I talked a little bit about. We have 2 senior centers and Meals on Wheels. We have rent and utility assistance, and we have 2 family resource centers. We have a family resource center here in Chandler, and we have one in Gilbert. We have a senior center here in Chandler, and we have one in Gilbert. Our food bank is in Chandler. And I didn't say, but to qualify for the food bank, you need an ID and a piece of mail. And then we do ask that you sign a form that says that you are at the poverty level, but we do not ask people to give us a form saying, their W-9 or anything like that, saying that, showing us their income level. So it's fairly easy. And again, if we're not the food bank for you, we will serve you that day and then we will get you to the next food bank. Our homeless and housing services, we have iHelp, Interfaith Homeless Housing Emergency Lodging Program. Sorry, even though I've been here 4.5 years, I still have to think really hard to say that. That is our program where we work with 17 area churches. 1 church each night opens up their sanctuary so that we can have 20 people spend the night there. We used to be 25, but since COVID, to keep people safe, we're at 20. And then civic groups will offer a meal in the evening for dinner, and then they get case management that helps them. Lots of people that are experiencing homelessness have lost IDs, so we work with them to get their IDs. We do have many people that are coming to our programs that are working, but they were living at the poverty line and then something happened. And so they're just experiencing homelessness. Our program is roughly about 90 days. And I say that because some people, oh, thanks. Thank you. I had no idea. So I better zip through this because people experiencing homelessness have a myriad of things that are going on. And so we have resources for them. Our 2 senior centers had to close due to the COVID, but then our Meals and Wheels, as I explained earlier to the other group, has had 110% increase. Rent and utility assistance is very, very high demand, and we have over 10 areas of where they can get resources through that program to get assistance. And then our family resource centers, I'm excited to say that our Giggles, Squiggles, and Squirms classes are full for the fall. So lots of people are returning to school. They're adapting to having to do things online and know that that's the way we are going to do things right now until otherwise directed. So that is us in a nutshell. I'm proud of what we've been able to do. And I think I mentioned in the group, we have over 1,000 volunteers. We've been able to keep many of our volunteers through COVID, and they continue to serve, and we're very, very proud, but we could not do what we do if we did not have our volunteers.
Thank you.
They really help with all those services.
Thank you so much, Dara. We
Sure.
appreciate the amazing work of Ascend for sure. And with the expansion you guys have had, and Gilbert has had a significant contribution to access to all those needs for communities. So thank you again for the great overview of your services and for the work that you do. And next we have Hope's Women's Center.
Michelle Stifler, who is the Grant and Communications Coordinator, is going to present.
Awesome. And remember, we're trying to keep it within 5 minutes, and we'll give you a 1-minute warning.
I'm going to put this sheet into the boot camp so that everybody can access it. But we're a trauma-informed center, and we're invested in underserved communities. So we started in 1984 in Apache Junction, and now we have 6 centers. We're in Phoenix, Coolidge, West Valley, Maricopa, and Camp Verde. And we're all about engaging, encouraging, and equipping women and teen girls in crisis. So we're focused on holistic health, and our services support her holistic health. So we do a lot of education, a lot of classes. If you ever have a family that's working towards reunification, we have the classes that they need in order to reunify with their children. We do a lot of job skills training. We have support groups. We just launched our crisis counseling program last year in response to the mental and emotional distress that many were facing with COVID and isolation. We do pregnancy and postpartum support. We do free pregnancy testing, so keep us in mind for that if you ever need that. And then let's see what else. And then everything that our women do in the center, so every program that they participate in earns them points that they can use for food boxes, clothing, diapers, toiletries, baby items, and paper products. So we want to meet her physical needs as well as her emotional, relational, and mental needs. We do have childcare for moms who are participating in programs. That's usually a big draw because it's hard for moms with little ones to get out and do anything. So we do have childcare at most of our locations. Most of our clients are below the federal poverty line. So that's what our population looks like. And most of them have experienced abuse at some time in their lives. We serve anyone who comes to the door, so we don't require any documentation. There's no restrictions. And we're strong in partnerships and collaborations. So we're excited about this group because it helps keep us connected to other people in the community. We do a lot of referrals. We do a lot of connecting our women with other resources in the community. So it's important for us to know who's out there and what you guys are doing. As much as possible, we utilize the expertise of other organizations. So we have other groups in our centers too, teaching our women, training them, letting them know what they know. That's how we do a lot of our job training as well. So, so thank you for what you do. And if you ever want to reach out, it's Michelle@hopewomencenter.org. Let me know how you would like to collaborate.
Thank you so much for that wonderful overview of your services. Again, a great program that focuses on a lot of aspects of needs for women. And I like the fact that your organization really works also on unification of families. That's such an important part of your work, and we certainly appreciate all that you do. Next we have is Amanda Hope Rainbow Angels.
Should have Lorraine Tallman, who
Hi,
is founder. Wonderful.
Amanda, is this just the front picture? Or did you have this slideshow as well? Like the other?
You have the slideshow, right, Sarah?
And this is all that was in the slideshow. I don't have an additional slide. Amanda, do
Okay.
you have it on yours?
I can look right now. Hang on.
That's fine. I'll start talking while you look, and then if you have it, you pop it up because you had Shelby and Jesse sending you stuff. So, so good morning, everyone. I'm Lorraine with Amanda Hope Rainbow Angels, and we work with medically fragile children. We started the organization because Amanda Hope is my daughter, and she fought cancer twice. She had leukemia the first time and a brain tumor the second. And during the 4 years that we were in the hospital, there were many gaps in care and different areas that we could not get help in. And so it just became like, oh, when we beat this, we're going to do this. And when we beat this, we're going to do this. And so Amanda had literally a bucket list of ways she wanted to help families. And the very first thing that we're really known for globally is our adaptive apparel line. It's called Comfy Cozies for Chemo. And so it's they're like 33 styles, and families that have a medically fragile child that, have a port or a Broviac can go on our website and tell us your favorite colors, and they can have dresses and hoodies and tie-dye things and athletic wear and things like that. But they all have hidden zippers, hidden buttons, hidden snaps for whether they're having, they have feeding tubes and bloodlines and, chemotherapy and IV fluids and everything else. So it has like all these different compartments for all the different lines that our children need. Dignity and respect was a big part of Amanda's journey. She felt like she was just a protocol, and they would just come in and lift her shirt up and access her port, and the second time she fought cancer, she was 12. So that dignity and modesty and respect for her body was critically important. And she felt like, especially in a chemo room, I'm sure many of you have seen a chemo room where everybody's lined up. For a 12-year-old to have a grandpa or an uncle or whomever next to you getting to see your body, just because, you need blood or you need chemo or you need medicine or you're having an allergic reaction, you're being treated in front of other people. So it was very psychologically painful. And it was painful for her sisters to watch. And our insurance didn't pay for counseling until they were going to put her in through the transplant to get a bone marrow transplant. And then it was still a 6-month wait to even see the therapist, to get her qualified even for a transplant, because you have to qualify for a transplant. You have to be mentally strong. You have to have a clean home. You have to, all these different variants. So it was quite challenging for the entire family to go through all it is to be near death, or say you're not going to make it overnight or whatever, so you have these traumatic things that happen to you during that journey. But her siblings couldn't get help. I couldn't get help, things like that. So because of her journey, we opened up a free counseling center. So our families can come, and whether they're here for one session or the entire time they're going through their journey, or if they just need someone to talk to, we provide all of that kind of service for them. And the other thing that was devastating for me as a mom was feeling like I couldn't take care of my daughter or our family because the financial devastation. I mean, the average home cost for fighting cancers, I think the average nationally is $66,000. As many of you know, insurance doesn't, when you say you have a $3,500, that's all you have to pay. That's all you have to pay if it's allowable. If you need drugs or services that are not allowable, or physical therapy or whatever you need, That is not allowable. They're not paying for it. We had a patient recently that brain tumor, their insurance only paid for 4 MRIs. Well, they needed one every month. So, we had another challenge there. So we help our families advocate and get the help that they need through their journey as well. And of course, with COVID, the financial aid has been a big part of what we've always done, because I came home one time to my APS being shut off because we couldn't afford, we're paying this or that. So we needed help. So now we help with all of that. And the other thing we really help with is, because money was so tight, I wasn't eating in the hospital. So I would just eat my daughter's leftovers. That's just wrong. So we provide, I'm sorry, that just chokes me up because I walk in and I see these moms now and they're not eating. And it breaks my heart. So we make sure that anyone that's in a hospital and they need a meal or they need a cafeteria gift card or whatever they need, we're there to make sure that mom is cared for. So we do a lot of mindfulness with mom and coaching and coping skills with mom too, because they need it just as much as their child. So that was our journey. That's where we saw the biggest need. And that's what we do. It's just the here and now. What do we need today to support our moms and dads and our families? And, I'm sure Amanda's very proud.
Yeah, you've got 2 angels on your shoulder, Lorraine.
Yes.
You've got Marty and you've got Amanda. And I just want to cap off that one of the amazing services with Amanda Hope Rainbow Angels is also resiliency and as many happy moments as possible. So a lot of Lorraine's work and the work of the board and the organization is building in how can we make today, as Lorraine says, the best day ever. And so in addition to financial support, counseling, hospital visits, and what else does the family need and the patient need, creating those happy moments too. And I think that the past year and a half has demonstrated how important that is for everybody, but especially to those little warriors at Amanda Hope. Thank you so much, Lorraine. You're certainly a blessing.
Welcome.
Next we have is Child Crisis Arizona.
Good morning. I'm going to. Okay, I am just going to kind of pull up our website. My name is Caitlin Sagging. I'm the manager of family resources for Child Crisis Arizona. We have several different kind of programs and departments, all focused on just creating safe kids and strong families through prevention and intervention when it comes to child abuse and neglect. So on our website, and my picture is covering, you'll see an overview. We do have emergency shelters for children, and as well as foster care and adoption services. So going through the licensing process, all of that support services with the foster care. And again, our emergency shelters and a boys group home as well is kind of part of that department. We also do early education services. So early Head Start, both at our Mesa and our Phoenix, and preschool rooms as well. So again, kind of that intervention, really working with the families from birth all the way until they get into school and making sure that they're prepared when they enter school. We also have a counseling department for children. Obviously, when we're working with this population, just a lot of the trauma that they've experienced, making sure that the families have the support that they need. They are currently doing a mixture of virtual counseling, just I think like a lot of other places, as well as starting some of the in-person services as in addition to that. And then we have our family education, which is kind of my main department. So we offer free parent education classes. There aren't any requirements. There aren't any, residency, income, anything. They are open to anyone that wants to participate in them. So when they go on the website, we list our schedule. We are currently doing a combination of virtual, still through Zoom. We tried a few in person this summer, did not have great results, but we're trying again in the fall with some of our partner locations. And then we also created some of our courses as on demand, so that if it doesn't work with someone's schedule, there are classes available in English and in Spanish that participants can go and take. They can go back to and take at any time, and they're still able to receive a certificate for those. So if they are doing it for court purposes, or if they're doing it for their foster care licensing, that's just another option that we kind of created during this COVID time that we've seen great results and response to for that. In addition to our kind of long-standing programs, we actually have 2 new additions. We have recently, Child Crisis Arizona recently acquired independent living program. It was formerly under UMOM for teens that are in foster care. So it's essentially apartment style living, but there's staff and caseworkers on site to kind of help them through the process and make sure that when they completely age out, they're ready to be on their own without those extra support services. So that is very new to Child Crisis Arizona, actually just this month. And then the other addition that we had recently this summer was FANS Across America, which is located in Chandler. And I know just with who's on the call, there's several organizations that FANS has worked with. So hopefully some of you are familiar with them. But essentially FANS is a distribution center that will provide clothes, household items, personal hygiene, diapers, a little bit of everything that a family might need in kind of an emergency situation. So we work a lot with the schools and receive referrals for them, families that are, in transition or experiencing homelessness, some of the domestic violence shelters. So again, when, somebody has nothing and is having to start over, providing those basic items, the towels, the clothes that they need to kind of get them on their feet and get started. And again, with the diaper bank as part of FANS as well, people can come repeatedly with the referrals just to kind of get them through whatever it is that they are going through at that time. So that's another great addition to Child Crisis Arizona that we're really excited about. And I think I went through that really fast because I was worried about my 5 minutes, but I think that kind of covers, again, just big picture, some of our different programs that we have available.
Excellent, thank you. I like the on-demand class as well. That's pretty phenomenal there. And also that you, the parenting classes, a person, it's free to whoever, which really makes a difference for those who need those services. And sometimes people don't realize how much of that they need in regards to parenting classes and support. So thank you for that. Appreciate it. Then we have
a question.
go ahead.
Sorry, Caitlin, do you upload your promotional flyers for your classes to Basecamp?
Yes.
Okay. I thought I saw them in there.
So the fall one, once we get the fall, and it'll be September through December. So we kind of do them in big chunks, but yeah, I'll add it to Basecamp as well.
That's great for everybody to post, in any areas where where they have clients hanging out.
Yeah, that's a good reminder, actually, that for all the organizations, that if you have a flyer or specific information that you'd like everyone to be able to access and see, just to remember to pull it through Basecamp, and that helps everyone to have that access for you. Next, we have Jewish Family Children's Services.
Can you see my screen?
Yes, ma'am.
Okay. All right, let's go. Okay, so my name is Kristen Harvey. I'm with Jewish Family and Children's Services East Valley Healthcare Center. While JFCS has many services across the valley, I'm more focused on the our integrated healthcare centers today. We have many services across the valley. I will say, I'm not going to go in and talk about all of these all of these other services today, but if you do have questions about some of our other services, please reach out and I can get you connected with somebody to get you more information on some of our other services as well. So one of the things I do like to say is that we are open to serving, we serve everyone in the community. I get asked very often if we serve people, if we only serve people who are Jewish, and I just always like to say we serve people of all ages and all backgrounds. So please know that our services are open for everyone. So we have 4 integrated healthcare centers across the valley. So I'm with our East Valley Healthcare Center, which is in Gilbert at Arizona Ave in Guadalupe. And then we also have one in Glendale, one in Maryvale, and one in the West Valley. So for our primary care services, we accept all access insurance plans, DCS, CHP, Medicare, Blue Cross Blue Shield. And for our behavioral health services, the same as above, plus most commercial plans. And then we also do have a sliding scale for individuals and families who do not have any insurance. So I always like to point out, like, why integrated healthcare? Like, what are we doing that makes it important to be doing what we're doing? And one of the statistics that has always stuck out to me is that people with severe mental illness often die 13 to 30 years earlier than the rest of the general population from medical conditions that could have been treated by a primary care provider. So what we noticed was so many of the people that were coming in for behavioral health services were not getting their primary care services. They were not getting their medical needs met. And of course, they have so many barriers that we're seeing, from transportation to just not knowing where to go, or whatever barriers are coming up. So by being able to offer those primary care services under one roof, it's been able to help us get more people getting help with their overall health. And help break that symptom cycle. If somebody has something going on with their mental health, it's going to affect their physical health and vice versa. So our goal is to get people out of that symptom cycle. So at our East Valley Healthcare Center, we have primary care services for children and adults of all ages, therapy for all ages, including play therapy for children. We do psychiatric evaluations and medication management. We have education in classes, health navigation services, case management services for individuals who have the SMI determination, and we have high needs case management for children as well, who are with the Department of Child Safety. So when it comes to referring and starting services, one of the things that's neat is, I know many of us are from the East Valley here, but we have one centralized referral center that is housed here in the East Valley. So if you know anybody who could utilize our services for any of the locations, they're going to call that same, you can call that same number or use that same email, and they are going to connect the person with the healthcare center that is closest to where they're at. So when somebody calls in, or if you're making a referral, if somebody just wants our primary care services, they don't have to go through our entire intake process. But if they are coming in for any behavioral health services, we would set up an intake. They fill out a health risk assessment, and then they come in and they really work together with the treatment coordinator to match the individual or family with the services that best fit their needs. We have some people who are just going to come in and get medication management services. We have other people who want to come in and just get the counseling services. And then we have people who come in and utilize, many of our services under one roof. So it's really just going to be whatever that individual needs. And then we really want to work with all of you out in the community and know what's out there, because we're only doing so much under our roof. And that's where, if we're really looking at providing comprehensive healthcare and treating the whole person, that's where we need to be aware of all of the other resources that are out there, from housing, clothes, food, all of that kind of stuff. So that's our goal, is really to connect them with what we have here and then be able to refer out for other people.
Thank you. Excellent.
And so with that said, we're just always looking for how we can best support you and your clients and our community in the best way, in any way that we can connect and work together. That's what we're here for, and that's what we want to do. So again, this is our integrated health services, and then we have all of our other services that I didn't talk about today. But again, please reach out with any questions, because I can always get you connected with somebody from the other programs. And I will put my information in the chat if you are interested in connecting more. Thank you so much for this opportunity.
Thank you. Great overview again of the services that you're providing, a significant need. And I appreciate the fact that you showed also how referrals can be made. I think that's important too. And could you put into the chat too, I know that you mentioned that you accept all insurance major insurances? Is there a sliding scale or any charity cases that you take on? If you could add that into chat, that would be great too. And then we're going to move on to our next part of the agenda. So Janine Fowler from Maricopa County Department of Public Health will be providing us with an update on trends at this particular time as it relates to COVID and strategies for improving vaccination rates through communication, education, and access. And the county has worked so extensively over the past year and a half on providing really good up-to-date information to all communities and improving the vaccination rates as much as possible and really responding extremely well to all the needs related to COVID. So Janine, you now have the floor.
Thank you, Kathleen. I have a hard stop at 10:30. I apologize. So instead of jumping into a presentation, I'm going to give just a quick overview, and then I'm happy to answer any specific questions. So a couple of things I wanted to point out is I invited my colleague, Mackenzie Toole. Some of you met her in the breakout session today. Here she is on screen. And Mackenzie is, what we did during COVID at Maricopa County Public Health is we split the county into 5 regions. In each region, we hired what we call a public health liaison to manage that region. And it's been a huge, we think, a very, very successful strategy. We're going to continue growing that strategy. And what it helps us to do is to make the county a little bit more manageable for public health to be able to support all the nooks and crannies of Maricopa County. So Mackenzie is our East Valley Public Health Liaison. I invited her on today so she could see all the outstanding work that's going on in the East Valley, but Mackenzie will also be a good contact for any of you should you need any support at all from public health, whether that be a data request, or even if you'd like to host a vaccine clinic at your agency with the population you serve. So our numbers in a nutshell are not good. Every day it seems we're going up by about 200 cases due to the Delta variant. I was talking about this in my breakout group just a little bit, but you know, I'm not going to lie, it's pretty frustrating for us. We're working extremely hard to make vaccine as accessible as possible for people, and we will continue to do that. But we just still have a lot of people in our community that have various reasons, and some are very good reasons for not getting the vaccine. There's still a lot of hesitancy, but the bottom line is that we know the vaccine protects you from serious illness and death from the Delta variant. And like, that's just the black and white of it. So we are strongly encouraging, you know, everybody to get that vaccine. But we also recognize that we're not always the best spokespeople for the vaccine. People are a little sick of hearing from the government when it comes to the pandemic, and we get that. So we could really use all of your help and support, because we know the people that you serve respect what you're saying and respect your opinion. And I think the more that people can hear from people that they trust, that this is not a new vaccine, this is not experimental, and this could potentially save your life. We could really use all the help and support we can get. What we're really seeing now in terms of vaccine hesitancy is that people right now tend to uptake the vaccine if the people around them, their loved ones, this is not rocket science, but if people around you, if your spouse or your kids or people that your friends and family talk with you about the vaccine and are pro-vaccine, people are much more likely to take the vaccine after talking to someone that they care about versus hearing it from the government, from leaders. So I think the more that we can encourage people, even people who are vaccinated, that, hey, it's fantastic that you're vaccinated, but your job's not done. Now you need to get your network vaccinated as well. So we all continue to have a role to play. As we enter into the school season, I know this isn't a surprise to anyone on this phone call, but we're not able yet to give vaccine to kids younger than age 12. So we have a lot of kids that are not able to get vaccinated that are entering school. We know that by law, schools can't require masks, which is another challenge for us here in public health because we are expecting to see a lot more cases in our schools, and we're prepared to respond accordingly. It's just too bad because, you know, it doesn't necessarily have to be this way. And another thing you'll hear, I just saw the headline that the CDC is going to release new guidance today. And I'm not specifically sure what the guidance is going to say, but it's something to the effect of that the CDC is going to recommend that all kids in elementary through high school wear masks regardless of vaccine status. So I'm sure that's going to play out in the next days to come here in Arizona, but you'll all be hearing about that, I'm sure, later today. So just a heads up about that. We've got a lot of great resources in terms of accessing vaccine. If you haven't visited our website, I encourage you to do that. We've worked with a lot of the pharmacies to get their appointment schedules up on our website. We have all of the pop-up events we're doing. We post up on our website. We have a call center. That number is 602-506-6767 for any person that just wants to find out where the closest vaccine is to them. Our call center will help them find a vaccine location. We also have, we've worked with 211 and we've developed a Promotora network through 211. So if you dial 211, there's an option to talk to a Promotora about both getting vaccine appointments, but also any sort of health needs that you may have in the community. Those individuals are getting trained up in all the services that 211 has to offer. So that's just another resource. But I'm going to stop there. I know I threw a lot at you. It's vaccine all day, all the time here at Public Health. But if there's anything that we can do to support you in trying to get vaccine out to the community, we're ready and able to do that. Are there any questions?
Thank you so much, Janine, for that overview. I think you did a great job in hitting the key points that we are the sphere of influence for many of our friends and families and or individuals served through our organizations that can help get the facts out and help encourage vaccinations, and also the use of the website to see those pop-up events, the increased number of locations providing the vaccine. And I love the 211 Promotora approach as well. I think getting that information out to our constituents and sphere of influence is also important. Are there specific questions from the group?
I had a question. Janine, how are you deciding on your pop-up events where they are?
So it's really a multi-pronged approach. I'm sorry, I don't know who asked that question.
Oh, Melanie from the town of Gilbert.
Oh, hi, Melanie. It really, we are both doing a proactive and a reactive approach. So people that reach out to us directly, we're working with them to set up events. We're also looking at the vaccine rates in the county and trying to push events to areas where we know that there's been lower vaccine uptake, but not just by us popping an event up, by really doing some thoughtful outreach, looking at leaders in that area and working with leadership, but maybe it's a faith-based institution or could be a community center to help us create such an event. So Mackenzie's kind of been spearheading a lot of our work in the East Valley. And so if anyone's interested, they can reach out to Mackenzie and she can work with you on potentially setting up an event.
Thank you. I think this is a great opportunity for anyone in the group who feels that they would like to participate in an event to let Janine know, of course, as well. Or if you have a particular population that or folks that you feel need access, that can be brought to our attention. Other questions from the group before Janine has to pull off the call?
Janine, I had a question, just if this is Amanda from One Small Step. Do you have data yet showing trends with like the underserved community specifically? Things that we should be aware of with, most of us are serving families in poverty and underserved communities. So, do you have trends and information about that specifically that you could share?
Yeah, so we have some of that trend data is on our website. We put out weekly data. So we do have, for example, by zip code, what vaccine rates look like by zip code. And so that can be overlaid by, we know that some of our zip codes have struggled with poverty more than others.
Yeah.
We do look at it by race ethnicity, but I will say that a lot of people don't offer that information up to us. So it's a little more difficult to have great data when it comes to race and ethnicity. So that comes with a lot of limitations. We do know both locally and nationally that African Americans are far less likely to be uptaking the vaccine. And I think that there's been a lot of research delving into that, but some of that I think is historical and is going to take a lot to overcome. And also what we're hearing is there's so many other needs associated with some of these groups that when we bring vaccine alone sort of isn't enough as for a draw. So for example, when we're doing events with our schools, most of the community-based agencies or schools are offering these backpack events with the vaccine. We're also doing events with food boxes and vaccines. So I think as much as we build sort of events within the events so that people can get many of their needs served, I think that's the best case scenario. So we're looking to try to do more and more of that. It just takes just a little more planning and more bringing more people to the table.
Yeah, thank you. I think to your points earlier, Janine, we've just got to keep focusing on where we can, producing facts, access, and education that helps folks feel comfortable and reduces that hesitancy. All right, Janine, I know you have to pull off because of another call or meeting, so we really appreciated your update today, and we'll see if perhaps another update is necessary in October, but thank you so much again for being here today.
Sure, and if anyone, I know Mackenzie can put her email. Mackenzie, can you put your email in the chat so people can reach out to you as well? And I'm always available for questions as well.
Thank you.
Thank you, bye.
Great update and important information. I think really at the end of the day for us, we've got to focus on our constituents, access the materials and the resources from the county to provide information, and also if we have the opportunity and where we serve to provide an access point for clinic vaccinations to do so. All right, next on the agenda really is that we have Melanie's going to provide a little bit of an update from our April survey. There was a request for some additional information that respondents had. And so Melanie's going to do is just kind of do a check-in on that response for information and then any other updates from the town of Gilbert before we close our call today.
Thank you, Kathleen. I'll go quickly since I know we're already at our stopping time. We're a little bit over for our meeting, but you know, great opportunities to connect with everyone. So some of the questions that that you'll see on the agenda that people still kind of wanted to connect about was, you know, who's having success with the virtual case management, how that's going, what does that look like? So my thought was just to move this a little quickly is if in the chat you can either say you've found some great success or if you're struggling with how to make it work the best, put that information in the chat and look for that so that you can connect with each other on how to maybe talk about that topic. And we can maybe in our next meeting try to bring this out a little bit further. Same with navigating payroll protection plan loan forgiveness. It sounds like some organizations were trying to look for best practices of how to make that happen. If someone's been really sick, went through, you know, very smoothly, you know, maybe put that information out there so that you can look at, you know, who's done that if you need a little bit of guidance or want to talk with somebody. There were questions about funding opportunities, so I'm going to go over those kind of quick because I know that's usually what everybody is very interested in is what current or possible upcoming funding opportunities there might be for support. So I'm sure many of you have heard of ARPA, which is the American Rescue Plan Act, and that there's lots of money coming into the state. Money is coming to cities and towns. Gilbert's allocation was actually a little bit lower than it even was the first time we got the CARES funding. They use a certain formula allocation and we just ended up with a little bit less than we have in the past. We have not made any formal final decisions through council as to how to best expend it. We have made some proposals and pitches to them as to how we suggest that it might meet the interests of our council and our community. But because the regulations are not actually out yet as to all the details of how you can use these funds, there's certainly not anything that's moved forward. However, I will tell you there is going to be a focus on our Family Advocacy Center. I think many of you have heard that that's been a need for the town of Gilbert to work with more of an integrated opportunity for us when we deal with those who have, suffered trauma and abuse as well, and to make it as less severe for everyone as possible. So a Family Advocacy Center is definitely something that's on the board for our council. However, I have put a pitch in for nonprofits. So we are looking at a possible 5% allocation towards nonprofits of our overall funding pot. But we are looking at that wouldn't probably take place until we roll out our next general fund allocation process, which most of you are aware of. We kick that off in January. So applications would open in January again for us to receive financial support to our nonprofits. And at that point in time, we're hoping that we're able to roll in some of these possible additional funding source. So that's what we're looking at there. So that's, some of what we're able to offer through the town of Gilbert. So we'll certainly try to keep everyone posted. We usually try to get some information out when those funding opportunities are coming available, but I don't expect anything necessarily prior to the beginning of January. So that's some of the funding. Again, some of the organizations were asking about how you can still maybe receive donations such as sanitizers, disposable masks. I know Helper has been kind of a organizational group that has helped collect a lot of those supplies. And so make sure that you go on their website, helper.org, and you can put in a request for support if you still need it. So I know they had some supplies still there, so you can look to that. And again, somebody had asked any future COVID relief funding that may come to Gilbert to sustain the efforts. Again, really the only other funding source that would be available to Gilbert is those ARPA funds. There will be probably some other state available funds, but they won't necessarily get dedicated to the cities and towns. We haven't heard of any other funding coming through that. So my other two things I just want to mention really quick is that we are going to be kicking off our FACE Summit. And the theme this year is actually building one bridge between kind of our faith organizations and our nonprofits. So some of you I'm going to be able to, and some of you have heard from me, I can only have so many on site, but the goal is to make sure we have collateral from every single nonprofit organization that serves Gilbert so that we can make sure to make that information available to our faith leaders in Gilbert who always are looking to get engaged, always are looking to figure out how can they do service. And so we're looking, so I will be making sure to reach out to everyone if you can send me kind of a brochure highlighting, what you do. I'll let you know how many that we'd be looking for to make available to the on-site group when we have that meeting, which will be the end of, it's September 23rd. So with that, the only other thing I wanted to mention is that we have a small committee that's been working on an opportunity that we really felt it was important to recognize what we call our second responders, which is all of you, because we have our first responders who might help save a life, but all of you are the ones that are putting the lives back together. And we wanted to make sure that our community and our region was aware of all the great work that all of you have been doing. So on September 1st, we're going to be trying to promote a day that is in honor and recognition of all of you as our second responders. So I just wanted to let you know that. Hopefully that'll get out there and some information, but we do appreciate everything that you have all done for all of our residents in need. So with that, I will wrap up that section. And again, try to communicate with each other on some of those pieces, put some notes in the chat so people can look through to really try to connect on getting the information around some of these subjects since we ran a little bit long today.
Yeah, and thank you so much for that update, Melody. Appreciate it very much. Certainly we'll have a chance in October to cover some more funding opportunities and some of what was discussed today. We, for the organizations that will be our spotlight for the next event, perhaps we could do that and just post it and communicate directly with those organizations for the sake of time. And if there's any other follow-up questions, please reach out to us and we'll respond back to you in a timely manner for sure. Again, thank you, everyone. Our next meeting is going to be in October. It may be in person, it may be virtually. We will let you know, but we'll be planning for that as well. Please be safe and take care of yourselves, and God bless you and have a wonderful day.